Welcome to USMLE World, where we ask, answer, and explain USMLE questions. Today, we're diving into Step 1, Embryology. Let's get started with question number 1. For the following case. If fertilization and implantation occurred at this cycle, when would the beta-HCG level be detectable in the serum? A. 1 day after fertilization. B. 3 days after fertilization. C. 8 days after fertilization. D. 14 days after fertilization. E. On the day of fertilization. The case scenario is: a 41-year-old nulligravid woman comes to the office for evaluation of pregnancy. Menarche was at age 12, and her menses recur every 30 days and last for 5 days. The patient and her husband have been trying to conceive for the past year and plan intercourse during her fertile window according to the ovulation predictor kit. She has no medical problems, takes no medications, and has no allergies. BMI is 23 kilograms per meter square. Vital signs and physical examination are normal. The question is: if fertilization and implantation occurred at this cycle, when would the beta-HCG level be detectable in the serum? Your options are: A. 1 day after fertilization. B. 3 days after fertilization. C. 8 days after fertilization. D. 14 days after fertilization. E. On the day of fertilization. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is C, which is 8 days after fertilization. This question is designed with the focus to assess your ability to apply foundational science concepts. An ovulation predictor kit measures urinary LH and becomes positive 24 hours before ovulation. Once an oocyte is released from the ovary, sperm may fertilize it for up to 24 hours. After fertilization, the second meiotic division completes and a zygote forms. The zygote travels through the fallopian tube and undergoes mitotic divisions, cleavage, creating smaller cells, blastomeres, that are collectively known as a morula. The morula enters the uterus 3 to 4 days after fertilization and develops a blastocystic cavity, becoming a blastocyst. If you choose any option other than C, you are wrong. Let's briefly discuss the other options. Choices A, B, and E cannot be the answer because the blastocyst implants 6 days after fertilization and the outer cell mass, which is the trophoblast, differentiates into the cytotrophoblast and syncytiotrophoblast. The syncytiotrophoblast invades the endometrial connective tissue 6 to 7 days after fertilization and starts secreting beta-HCG, which signals to the corpus luteum in the ovary to continue producing progesterone. Accordingly, beta-HCG may appear in the maternal serum 6 days after fertilization at the earliest and may require additional time to rise to a detectable level in serum, typically 8 days. Beta-HCG is detectable in the maternal serum at less than 5 international unit per liter, making serum beta-HCG testing the most sensitive method of detecting pregnancy. Choice D cannot be the answer because a urine pregnancy test is less sensitive than a serum pregnancy test. It becomes positive when beta-HCG reaches 20 international unit per liter, which typically occurs 14 days following fertilization. Your take-home message from this question is that beta-HCG is produced by the syncytiotrophoblast after implantation, which generally occurs 6 to 7 days after fertilization at the earliest. Beta-HCG typically is detectable in the maternal serum approximately 8 days after fertilization, whereas it is detectable in the urine 14 days after fertilization. Therefore, a serum pregnancy test will be positive before a urine pregnancy test. Did you get the answer? Click on to test your next medical mastery. But even if you stumble, remember, repeat, review, and rise. Understanding unlocks progress. Ace your USMLE with our top-notch resources. Share the knowledge, like and subscribe, and watch your success soar.